Welcome to The Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Well, hi, everybody, and welcome to The Hanley Effect. I'm John Dybin.
I'm Rachel Dosical. How are you, Dr. D?
I'm good. So, we always talk about how I'm always excited.
I know.
But
I'm
today we've
excited.
actually got a first.
Yes.
This is a first for our podcast. Been doing this a little while. We have a disclaimer.
We do.
And
first disclaimer we've ever had.
And who knows if we'll have more, but, this is definitely the first.
I'm excited.
So if you, we're going to talk about adult things. So if you, and I encourage people, this is important. It's good information.
It's going to be fun.
If you're, we're going to talk about adult things, including sex. And so if you've got kids in the car and you happen to listen to this, if you want to do it, listen to it later, you can, but we want to let you know. And I hope that everybody will stay right tuned in because this is, it's an important topic. It's not the only thing we're going to talk about, obviously.
Well, maybe.
Well, I love that I can now say sex.
There you go. Right. That's right.
Because I was your first.
That's exactly right. And they've turned
Pun intended.
Absolutely. Always.
So who can I?
Yes, please.
So I've actually gotten to know our guests over a lot of years. I mean, my goodness, it was probably 15 years ago that you were teaching a psychology class, and I got to come out and speak to your class, and I told a story because I like weird things to eat. I like to eat Campbell's chicken noodle soup with a bag of pizza flavored combos in the soup. And
in the soup.
Oh yeah. Since high school.
All right.
And later that week, I get a package in the mail from our guest, and she actually thought to get a can of soup and some combos for me. Yes.
Wow.
Our guest
you
today,
were well fed.
I was.
Wow.
Our guest today is Dr. Rachel Needle. Rachel, we're so glad to have you here.
Thank you for having me. I'm excited.
Awesome. So Dr. Needle is a clinical psychologist. She has been in this community, and her family, and you can talk, she has kind of a legacy of serving this community. You are known for you're not only a psychologist, you're also a sex therapist and a sex educator. So you educate other therapists on how to do sex therapy, and I think I would say a sex educator. Period. You just put out some really great material. You're the queen of social media. And I mean, the list goes on and on. So I'll be quiet now and just say, hello, Dr. Needle.
Hello. Thank you for having me.
Welcome. Welcome.
Well, we love to start by, the list of things you do is ridiculous. You're all over the place. You've been in this community, but we like to ask people this, right? Tell us a little bit about who you are, kind of what you do, but even more than anything, we love to know about your journey. What got you to doing what you do today?
Sure. Wow. The loaded questions.
Yes.
So I'll start with who I am, what I do. As you mentioned, clinical psychologist, certified sex therapist. But I do a lot more than that. So I seek some clients privately. I used to run a large group practice. I do no longer do that. I sold that last year. I have 2 schools where I educate mental health professionals and others actually now on different things. Such one school is specific on sex, so I train sex therapists around the world. Also have a PhD program in clinical sexology. Then I started, and that's Modern Sex Therapy Institutes. Then I started Palm Beach University, where I have PhD degrees in couples and family therapy, trauma, mental health, substance use and addictive disorders, forensic mental health, and also do clinical sexology there as well. And then for about 15 years now, I have gone around the country and worked with different mental health and substance use disorder facilities, helping them do anything from start from the ground up and build their entire programs to helping them be more ethical while also expanding and making more money to program development, educating and training staff, anything, you name it. So I've been a consultant since 2006 doing that. And
when do you sleep?
I mean,
now more than I used to, actually. I need it more. I don't know if that was after COVID or just getting older. But I used to not need much sleep. Now I do. So I do sleep. But yes, I do a lot. I work with mental health professionals as well, helping them start and grow private and group practices. So
Wonderful.
So tell us about your journey. How?
Yeah.
I mean, this is it's my head's spinning, right? Always knowing all the things you're doing. Yeah. What got you here?
Yeah, so I often say, I was born into a lot of what I do, but very parallel roads to getting here. So I have my father, two parents, mother and father. My father, when I was 8 years old, decided to walk into an AA room and never walked out. So growing up, so 38 years now that he's been in recovery. So watched, him drinking for the first 8 years of my life, and watched the process of him not drinking for the remainder of up until now. Really was always interested in substance use disorder. My brother as well is now in recovery. Learned a lot about it growing up. Always when I saw something, wanted to understand it more. That was just always who I was. And so that was sort of my first love in the area of psychology. And then my mother owned a women's reproductive health center. She opened that when I was 2 years old. So I was literally born into this life of wanting to understand and gain information about reproductive health, mental health, substance use, trauma, and sexual health. So at the age of 16, I started peer educating for Planned Parenthood.
Wow. I didn't know that.
Yeah.
That's amazing.
So really, I've always felt like knowledge is power, right? And
Sure.
so I like to make sure that people are educated and they make informed choices about their health in general, mental health,
Sure.
sexual health, all health. So I think it's really important. It's really been a core value of mine throughout my life. It's in a nutshell there.
Tried to
fit it all in.
a pretty
That was
good
good.
nutshell. So, I think I told you before that I have my word that you kind of de-taboo. Is that what I said?
De-taboo. I love it.
Right.
It's my new favorite word.
So, and so you have a regular, every week you do on social media, you do a mental health, minute. And every week you do Sex Tips Saturday. And when I started watching Sex Tips Saturday, because there's Rachel Needle, and you will talk. I mean, I'm not going to say that I didn't blush right on and I'm, and here I am, and I'm thinking I'm a marriage and family therapist, and we're, but you talk so openly and just freely and intentionally, and put this out there on social media. Talk about things that that couples and that people actually think about
And struggle with.
Yes, but don't talk about. Why do you do that? Why do you get on there and talk about things that might make me feel uncomfortable?
Well, first, because not everybody does, right? And I think it's so important to have these conversations and comfortably. And I think that's one of the reasons, people will often say to me, like, how long does it take someone to open up when they come into your session? And, people must feel uncomfortable. And the truth is, even the person you would think would be the most uncomfortable when I'm speaking with them, when they see how comfortable I am with it, they seem to just relax and get more comfortable. So being able to have these conversations and say these things, without blushing or without being uncomfortable, really gives people permission. And I think that is so important in general, just people knowing that it is okay to have these conversations, that it's okay to talk about these things bluntly and openly.
Yeah.
So that's why I do it, so that other people will, and because I love talking about sex and now I get paid to do it. So,
Might as well.
I mean, why not?
I will, but I'll tell you, that's why I have, and I've told you many times, like I really deeply appreciate you do that, because there's a normalizing of, and it's not normalizing something that's not normal. You talk about things that are happening in people's relationships all the time, but it's normalizing talking about our human experience. And I have such a deep appreciation for that. Anytime you think about things that we experience, but that we don't talk about or that we're afraid to talk about. Normalizing that and giving permission, I think it makes us more human, gives us permission to be more human.
Well, and the stigma associated with drugs and alcohol, with sex, I mean, I don't understand. I mean, we would be healthier if everybody could just put up their hand and talk about whatever it is that they're challenged with.
Right.
Yeah. And it helps people to understand others, right? We said substance use it's very similar, right? Like people judge and they think things a certain way. And when you can give them information, educate them, and talk about it, it allows people to be more comfortable, but also more accepting of themselves and others. And that to me is so important. People often say, like, what do you mean? You do substance use, trauma, and sex and relationships. I'm like, no, I do them all together, right? They're so interconnected. And all parts of us are interconnected. So I think it's so important.
I'm just curious, before we get off Sex Tip Saturday, have there been, I'm just curious,
Your numbers might go
We're
up.
never off Sex Tip Saturday.
Is there a particular subject within that subject that people really want to talk about more? Is it, is there something that, your viewership goes way up when you hit on that particular topic?
I think the more risk I take and the more detailed I get, the more people enjoy it. I have one friend and who very funnily said to me at dinner one night, stop doing all the communication and the relationship building and this, which obviously is very important for sex and it makes for better sex. Right. But he's like, want to hear more about the kink and the threesomes and and I won't go on because then we'll have to give more disclaimers. But they want to hear the things that more people don't talk about, right? And I can't do that without mentioning the communication and relationship stuff because it's so important. And but I think people like the more detailed I get, and the topics that are more taboo are the ones that are more popular.
Wonderful. Yeah. Wonderful.
And the truth is, sexual health is a part of overall quality of life.
Right.
We research shows that the more sexually satisfied we are, the better our relationships are, the happier we are. So it's makes it even more important to talk about, and for people especially that don't want to talk about it, because that they're probably struggling sexually if they're not talking about it.
Yeah.
With talking about treating, looking at all those things together, some will talk about process addictions, and they'll talk about sexual addictions. And what are some of the things that are there downsides? Are there dark sides? Is that a real thing? Sexual addiction.
Yeah. And so I'll tell you that I don't use that term. If someone comes in my office and they use it, they can use it, and I'll use whatever term they do, but I will at some point share that. I like, compulsive sexual behavior better. And we look at this, obviously there's some overlap with, actual substance use disorder and addiction, but even the ICD-11, put it in the impulsive behavior, out of control, or impulsive behavior category as opposed to addiction. And there's a reason. There's, in terms of brain studies, we see some overlap. We don't see a lot of overlap. And the truth is we see some overlap with people having really great sex and just good sex in terms of what happens in the brain. I also think that there's a lot of we see a lot of issues in terms of more classified in terms of things people aren't comfortable with morally or value-wise, as opposed to, and it leads to a lot of guilt and shame when you kind of go in that direction. And lastly, you're not gonna have somebody just abstain from sex the way that a lot of times in recovery, you're going to have them abstain from using it all. Right. It's kind of like eating. You're going to have to eat at some point in your life. You're going to want people to have sex to lead a happier life eventually, most people. So I don't see as much overlap as some do. Again, so I approach it from a different perspective. Also in treatment, I approach it very differently. For some of the reasons I mentioned. But, a lot of times also we see in famous cases, right? You see them not taking responsibility and accountability and just instead saying, I have a sex addiction. I don't think that's helpful to the person that's struggling either, nor the person that they're with. So I lose a lot of clients that way. I also lose a lot of business in the addiction space that way. that's okay. That's truly what I believe. And again, how someone wants to approach it, we can go there, and then I can educate them along the way to help them view this in a way that is best, most fitting and comfortable for them.
Love that.
Love it.
Love it.
Yeah.
So, and I actually want to learn much more about like that perspective. We only have so much time right now.
Well, that's why you're going to have me back.
So,
you know?
And again and again and again.
So, Dr. Driscoll and I both have daughters.
Okay.
We both have 2 daughters.
We do.
And I am, one of the things when we thought about, when we knew you agreed to come on, which thank you again for, being here. I think about, I have this wide range. Yours are both,
Mine are 22,
right.
19. So
Okay.
mine are pretty close.
Mine are almost 28, right? And almost 13. So thinking about that, how, and a lot of parents probably listening, right? It's tough for parents to talk to their kids about sex and about sexual things and about, even though none of us are dumb. We all know that our kids are going to be faced with different things. I wonder if you can talk to us a little bit about what are some of the challenges that you see that kids face now that we may or may not think about, and what are some things that you would say to parents, like how to talk to our kids in a healthy way, or how to help them have a healthy perspective on sex without having some of the things that maybe we might have been burdened with.
Yeah. So first, parents have to be educated themselves, right? It's hard to educate your child if you're not educated. So recognizing if there is a gap, I think is so important, right? You probably haven't learned about everything, right? So whether it's reading or seeking out people like myself and asking questions, so important. And then you'll be better able to help your child. In addition, just dealing with any discomfort that a parent might have around it so that doesn't show up to your child too. If you're uncomfortable and you try to talk about it, chances are your child's going to end up uncomfortable too.
Yes.
So I think that's the first step. And then also realizing, that it's not a talk, right? People talk about, have you had the talk? It's an ongoing conversation from as soon as they're born, right?
Yes.
And it's answering questions honestly, not the stork dropped you off. Yeah. It's answering honestly in age-appropriate terms, age and developmental appropriate terms, and language. And so it's an ongoing conversation. And once you have it like that, then your child is not going to feel uncomfortable at 15 when you start trying to have a talk, because you've already set that stage. You've used proper terms, right? I can't think of anything. And again, I understand because people haven't been educated. I don't blame them necessarily, but once they learn, I hope they make those changes. It's like you say, this is your nose, this is your eye, this is your ear, this is your private. No, this is your vagina. It's literally a medical term, right? This is your vulva, this is your vagina. And you tell them the difference. Yes. Because again, if they can talk, they're also more likely to protect themselves, and to understand if somebody is doing something that is uncomfortable or not okay, right? You set them up to be able to have those conversations, talk about it, know when they're not comfortable in their body, when they are, be more comfortable when they can be or should be. So those things are so important. So that's the first part. I think you asked the second part, or the first part, or the second part. The first part you asked about was children and what they, sorry.
What are they dealing with, right?
And so I think the biggest thing right now is that the way they're getting educated, the majority, is through sexual imagery. So what people call pornography.
Yeah.
Right?
I want to talk about this.
Yeah,
I want to talk about this. Go ahead. You start.
No, that's okay. So when parents aren't, or they're not getting it in school now, right, because it's getting blocked, and the people that need the most are the ones saying, I don't want my child to learn that. And so that's how they're learning. So their sexual imagery is not in itself a bad thing, right? Where it's bad is when it's not accompanied by explanation, and education. So if you can tell your children what it is they're going to see and help them understand, again, they're not more likely to have better sex. They're more likely to use protection, contraception. They're more likely to not get sexually transmitted infections. They're more likely to have sex that is comfortable for them and have it when they actually want to, not because they're being pressured to do so. Right. So I'll let you. I'm sure there's lots of.
Well, I again, mother of 2 daughters. I am concerned, especially with young men, that as they are exposed to porn, they truly think that that is what a loving relationship between a man and a woman looks like. When my kids were young, whatever that TV show was, we started with SpongeBob. I would watch, or my husband would watch the show with them. Not because we thought there was anything that necessarily was negative on the show, but we knew that some of the themes and some of the words that were used were things that they wouldn't understand. And we wanted to be there to be able to explain it. The kids were, certainly they were teenagers at this point, but when they watched Glee, I watched it with them to make sure that I could explain. And it is, it's deeply troubling to me that kids who are looking for information about sex are watching pornography and thinking that that's what a loving relationship looks like, or that's what sex looks like.
Absolutely. So, if all you do is watch, especially the things they're actually gravitating towards, there is some, sexual imagery or porn that is, does show, relationships and sort of going into that. And some people enjoy that. But the things that they're gravitating towards, or they're being shown by their friends in school, or their older siblings or their friends' older siblings is what you're describing. And so what they'll see is that, for, a female identified person that, they have an orgasm in 10 seconds, right? And that they need to do X, Y, and Z. And that, they're being shown this is how it's supposed to work. And that a man is hard all the time, 100% of the time. And if they're not, that there's a problem. And that they'll last 4 hours, and that you should last 4 hours, and that someone wants you to last 4 hours. I mean, so, without explanation, there's an issue there. Or that, people enjoy certain things, or, that certain things are bad and that other things are good. And, that's not always the case. And you don't see a whole lot of variety. And understanding that people like different things, and that it's going to take different things to, bring other, different people to pleasure. And that, having an orgasm every time isn't the goal, and but pleasurable sex is the goal, and connection. And, for young people, one of the things that I found, I have 2 nephews and a niece, when they were younger, they're older now, is not just their discomfort. I remember taking them to, what was that movie? Get Him to the Greek, or Bring Him to the Greek, when Adam Sandler had sex with all the people in that. Yeah. And I remember they were like this. And, I'm obviously trying to talk to them, right? I'm trying to, and they're just like this, like, don't look at me, Aunt Ray, don't look at me, And, one of my nephews coming to me after he had sex for the first time, and having to have the conversation with him about, again, about condoms, and also that doesn't mean that every time you see your girlfriend, you have to have sex. And that doesn't mean that every girlfriend you have after this, you have to have sex with now. And, being able to have these conversations and seeing conversations even happen, right? How often do you see the communication about me asking you, in porn about what you like and what you want? You can't have good sex without that, because what you like isn't what you like, and what you like isn't what I like, so it's so important that, going back to the parents, that you educate, that you talk to your kids about it, that you see the kind of porn they're looking at, that you try to help them understand what is comfortable, and also what might not be okay, right? Like if somebody does something without you wanting it, or if you say no and they continue, that is not okay. That is you revoking consent, or not giving consent, or not being okay with what they're doing, and then that's called rape.
Yep. Yeah. And consent is such a big thing, especially with daughters, but I don't think so. It's important with everybody. There are just as many men that would be uncomfortable as well.
Yeah, absolutely.
Yeah.
It's interesting. I'm sitting here thinking, about some of my own, and how my own conversations and my ability to talk has changed over the years. And when you're, in your own practice, and I know that you do a lot of, you're really doing a lot of educating right now. Is that your primary?
Yeah, maybe 6 to 8 a week. Yeah. Mostly running businesses and educating.
Yeah. That's a lot.
Yeah, that's all.
That's a lot.
That's all.
That's all.
But in your practice, when you do see people and talk to people, and I had forgotten that I actually called you once a few years ago about one of my kids, and asked you, and I totally forgot this, and there was something really strange, an adult kid, and I was like, I got to call Dr. Dieter. I can't believe I don't, because I think I'm supposed to have all the answers, but I call it, and it was really, really helpful. Is there anything that you're seeing trend-wise, like that is, and I don't even know that if you have an answer to this, but I'm wondering, are we getting healthier, or are we struggling more with this? It's a weird time.
That's a great question. I don't know that we're getting healthier. There is some more openness, I think, to having conversations, which is the first step to being healthier, I think. I think there are still people that are struggling with that being okay, or if they're partnered, being on the same page as their partner about what's comfortable and what's okay, what's not okay, having these conversations with each other, then their children. So I think we're taking a step in a good direction, I think, but there's still a long way to go. There's still a lot of detabooing to do.
Detabooing? Yeah. Can I
I'm using your term. You totally should.
I
Or trademark it. I think we should put
do
on
it.
hats and stuff.
Yeah. Make a logo.
Right.
Yeah.
Okay. Detaboo. So somebody who's listening, detabooing. So
It's hilarious.
Copyrighted right now, though, so it is
It
Dr.
is.
John Divens.
Yes.
I mean, we want in on it, but
right,
we're
it's
just
the
making-
three docs,
we're
right?
Making,
We're
we're
all-
making clear that
royalties.
no one else can take that.
Yes.
I love it. So I know we're coming towards the end of our time. Believe it or not, we go fast. But I do want to shift a little bit. And this just hit me. That we are in Palm Beach County, Florida, and there's a mental health crisis in our and there is a believe it or not, there is a shortage of mental health professionals.
Absolutely.
And you're so much of your, you started, you had an enormous practice and a very successful practice. And I wonder if you can talk to kind of the budding mental health professional, or the people who are just kind of starting out. What advice would you have, or what advice even do you maybe wish you'd have had that you've learned along the way? Because we need I think we all know that we need this young, new mental health professionals to thrive. And I wonder what you would say to them, the advice or things that you've learned.
Yeah, so for me, it's always, of course, take care of yourself, right? Put yourself first. Make sure that you are taking care of your own mental health. You're in therapy yourself. You're taking time off. I always tell people to kind of diversify a little bit. You will get burnt out if you're seeing 30, 40 clients a week for the next 30 years. You will. It's hard not to. Mental health professionals right now are in a sticky situation, right? I also tell people that as mental health professionals, I truly believe we also have to be advocates. And so giving back in some way, whether it's volunteering, doing pro bono cases, going to, protests or going to legislative day, doing things that help our profession is so important. I think it's a really tough time right now. You say there's a shortage of mental health professionals. I don't 100% agree. I think that there's lots of mental health professionals. Access to mental health services is limited, and that's the problem. I mean, Nova itself is graduating, 150 years. I mean, they're here, and this is a larger conversation, but in this country, the access is limited because insurance companies aren't paying, or the people that, a lot of mental health professionals don't want to take it because they're not paying, and because they are doing clawbacks and making it so challenging to keep it. Which is a huge issue, and so people are being burnt out. Then you have people graduating with, I think I had $250,000 in loans when I graduated. So most people's focus is on I need to make money, and so I can't do all these other things because I have to make money and I have charges, and so it limits the ability for them to do more. I think, and the focus is solely on I need to have a bigger practice. I need to see more clients. So again, I could go on and on about this topic. I think that is where the problem lies, and people doing things for the wrong reason. Also, some people, came into this field thinking I'm going to make all this money, and that's a whole other conversation. But, so I would say take care of yourselves. Remember why you got into this field for most of us, and take the focus off I have to do, and more about come back, try to get back to your heart and what, giving back in a way, because that is success too.
I love that.
I
And
love that
advocate.
too.
Yeah.
Advocate. I always think, if in our country we had a system where if your car was broken, you only had 5 minutes to with the mechanic, you would get in line and he would give you, and based on, he'd put some little duct tape on it and you'd go, like, we would revolt as a nation. And yet we allow that to be our healthcare system. So I love that. All of, taking care of yourself, remembering why you do this, and be an advococate. I love that.
And keep learning. Sorry, forgot that.
Keep
Keep
learning.
learning. Keep educating yourself. So.
And keep watching Sex Tips Saturday.
Yeah, and mental health, man. I'm in. Follow Dr. Rachel Needle. I got to plug that.
I'm not kidding. Follow Dr. Rachel Needle, and wherever you start finding yourself feeling uncomfortable, go talk to your therapist or your clinical supervisor, because that means that you've got a good a place, and it's not a bad thing. It just means that you got something a great area to work on.
That's right. I love the fact that you're doing so much teaching. I mean, just from how many clinicians report to you? Several dozen at least.
Lots.
I mean, a lot of clinicians. This type of education on an ongoing basis is so important. So
Absolutely.
important. Yeah.
And it goes to that burnout too. You know that.
Yep.
When therapists and professionals in general, when we burn out, when there's burnout, so frequently it's associated. One of the things is they have not been growing as a person or a professional. Yeah. So those things like we all, having our own therapy, having our peer supervision. So Dr. Needle, you've been a clinical psychologist for many, many years.
Yes.
So you don't need supervision anymore, right?
Wrong. I mean, luckily, a lot of my very close friends are therapists, right? So
Right.
I often will go to colleagues of mine and say, hey, difficult case, or hey, I have this question, even in business too, right? I'm somebody people come to for business too. Like in every area, you can always keep learning and you can always be better.
And
I love that.
Yeah.
We all need other people to help us have perspective.
100%.
So I love, we had recently a really seasoned therapist on, and we were talking about that same thing. And I think anytime we have a really seasoned therapist on, I'm going to make sure to make that point, that no matter how good you get, no matter how seasoned you get, no matter how educated you get, all of us need other people to help us have perspective. All right, so yes.
Oh shoot,
we're there.
We're there.
We have actually gone a couple minutes over, but I want to let you have the last word. So thinking, there's all sorts of people that listen to this: professionals, non-professionals, struggling people doing great. What is one thing that you would like our audience to hear from Dr. Rachel Needle?
It's a lot of pressure.
It's
Have great sex though.
I mean, that's okay.
I think it's important to, like in any area, regardless where you are, having support, whether it's mentors or therapists or friends. Surround yourself, because that's better for your mental health, for your recovery, for your sexual health. So all of the above. So seek out support. Have a great mentor or several. Keep learning and be kind to people. Have empathy. That's sort of what I've carried with me my whole life, and I think is the most important quality in a person.
And I have the chicken noodle soup and combos to prove it. Dr. Rachel Needle, thank you so much for being here.
Thank you for having me. I appreciate
Dr.
it.
Dosical, lovely as always.
Dr. Diamond, this was fun.
This was a blast.
This was really fun. Our very first disclaimer.
I mean, so good.
Sex.
Thanks, everybody, for watching or listening. We'll see you next time on The Hanley Effect.
Bye, everyone.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.